Nos van a presentar el estudio Visión General de los resultados.
Thank you. Now we have the overview on results of study on the perception of palliative care professionals regarding innovation, barriers, and facilitators by Dr. Mariana Silva.
You enjoy the workshop. Today I will be presenting an overview on the preliminary results from the study perception of palliative care professionals regarding innovation, barriers, and facilitators. Are you hearing me well? Yes? Okay. So, this study emerged from the need to better understand how palliative care professionals perceive innovation in their setting, which has already been described, because understanding the professionals' experiences, expectations, and concerns will help to build a solid foundation for the HENKO project and ensure that any proposed solution is aligned with the real-world needs. So for that, we built an online survey that is in both Spanish, French, and Portuguese and available in the HENKO website. Actually, I can give you a little time to scan the QR code if you want to answer the question later, because we are still gathering answers, and that is why this is just preliminary data, because this is results on 37 answers we have until the end of March. So I also want to note that all the multiple choice questions will be fully represented in graphs, but the open-ended questions will be either categorized or summarized by highlighting the main points for the sake of time. So, providing some demographic information, most answers for now come from Spain and France, and around 70% of the professionals have 0 to 10 years of experience in palliative care. Interestingly, we have a very balanced representation of professionals working in hospitals and residential care homes, which is extremely valuable to have both perspectives of these settings. Also, around 50% of the professionals that answer this questionnaire are doctors. So now, regarding the perception of innovation, around 90% of the respondents consider the level of innovation in their setting to be low or moderate, which is particularly concerning. When asked which areas require the most innovation, the answers were evenly distributed. However, the most frequently mentioned areas were training and education, communication with the patient, and family support. When inquired about the innovation that could improve patient care the most, the professionals mentioned communication tools among all stakeholders, but also in specific cases like patients with speech limitations, information tools, coordination tools for multidisciplinary home care teams, tools for data input, electronic records and interoperability, tools for remote care such as monitoring and symptom management, home care robotics, virtual consultations, among others, tools for training and aiding adaptation to the role of the caregiver, tools for personalizing interventions, tools to aid with administrative issues, consulting tools that could aid with ethical questions as breaking bad news, and intelligent systems for clinical decision making. Now, moving on to the next topic, that it's the barriers. Participants responded quite evenly across the different challenges listed, with the most common being lack of time and resistance to change. These topics will be discussed all over the questionnaire. When asked whether they agree with the statement, there is adequate management support for innovation in my workplace, it was difficult to draw a conclusion. Nearly 50% of the respondents were neutral, and the remaining answers were almost evenly split between totally agree, disagree, and totally disagree. So maybe in the future, it would be important to carry out a separate analysis to see if we can get any differences by countries or by care setting, but this clearly reflects how varied care delivery can be. When directly asked if a personally faced any challenge when trying to introduce a new practice or technology in their setting, the people answered lack of technological conditions or equipment, resistance from stakeholders, this from patients and families, but also from professionals and their superiors, lack of financial resources, lack of time, once again, lack of support, lack of interoperability between systems, because this often leads to multiplication of the digital information. Specific palliative care needs differ from other specialities also, so this also leads to administrative problems and slow dissemination, and data protection and drastic changes. Now, regarding facilitators, once again, the responses were fairly balanced across the list of options. However, collaboration and teamwork stood out, being mentioned by 30% of the participants. Funding and access came in second, followed by a tie in strong leadership and support policies. As for the statement, continuing education and professional development are encouraged and supported in my workplace, nearly 70% of respondents agreed or were neutral, with being neutral the most frequent. Still, it's important to note that around 20% responded disagree or totally disagree, which is also a significant concerning proportion. When asked to share examples of successful innovations implemented in their settings, the participants mentioned several interesting projects, which I'll briefly summarize. So, the use of technology to support care, such as advanced therapy, storages, cameras, etc., to help to monitor patients, the use of helper dogs to pain management, the implementation of a waiting list patient screening system using the RunPC tool methodology. And we also received 3 responses highlighting the experience with Paco Global, as Dr. Matthew mentioned before. Other examples included a coordination tool for doses therapy calculation, the organization of multidisciplinary consultation meetings between professionals from different institutions to discuss more complex cases, the use of instant messaging applications to speed up communication with the patients and the families, the project developed by Obra Social La Caixa with virtual reality glasses, the implementation of housing adaptations with work and support, advice to families on home monitoring systems, such as proposals for technology supports to families, and the HENKO project, which presents the maintenance of palliative care in the home environment with personal assistance. Next, the participants were asked 2 related questions using the same list of tools. The first was, which of the following innovation tools do you know? And the second, which of the following tools do you use in your practice? I found it more insightful to analyze both questions in the same graph so we can have a more direct comparison. And as we can see, there is a significant gap in what professionals are familiar with and what they actually use. This is particularly evident in more advanced technologies, such as remote monitoring, audio devices, telehealth, AI, VR, robotics, which are widely known, but less people use it. Regarding the tools that they do use, most people use them daily. And again, regarding the statement, the use of innovation tools has improved the quality of palliative care in my setting, it was very difficult to draw a conclusion. Almost half of the responders were also neutral, and the others were more distributed. We can see that agree and totally disagree is more than half of the remaining, but there's still a significant proportion of people that disagree or totally disagree. So once again, we will eventually do a separate analysis to see if there are any differences. Regarding the tools that people would like to use but do not have access to, the most people answered AI, VR, telemedicine, and robotics. However, interoperability systems were also mentioned to share clinical history, to coordinate information, for example, and emotionally support tools. Concerning the applications, they are evenly used across different purposes. All the purposes that are listed, as you can see in the graph, are very balanced. And most people find the technologies they use to be effective for their respective purposes. Now, additional purposes people would like to use technologies for but are not currently available is remote care for patients in distant areas, registration tools at home, which includes measurements and feedback, task delivery and check, education, investigation and teaching, data analysis, and intelligent predictive systems. Now, regarding openness, more than 80% of the participants revealed to be open or very open to integrating new innovation tech tools in their setting, which is very positive. And no one disagreed with the statement, "I feel confident in my ability to learn and use new innovative tools," which reinforces the openness of professionals to integrate new innovation tools. Regarding the factors that would influence their willingness to adopt new innovation tools, the most important factors would be user-friendliness, followed by proven effectiveness and training and support. Resources that would help professionals to feel more comfortable would be training and tutoring by professionals already using the tool, support from superiors and a community of use, leadership, evidence of efficiency, interoperability, user-friendliness, legal security, and time. So finally, the questionnaire ends with 3 open-ended questions. So I'll also use the main messages from these questions to wrap up the presentation. First, among the key steps to foster innovation in palliative care, respondent mentioned sharing good practices, training, user-friendliness and accessibility, so simplifying the tools that are tailored for older people. Information and dissemination, funding and resources, mentioning more staff and time reallocation. Institutional support, which also includes time reallocation and support policies, because health professionals feel like they already have a big workload, so it's difficult to also dedicate to implement a new technology in their daily practice. Coordination between social and health sectors, prioritization of needs, and really identifying the stakeholder needs, practical, interoperable, customizable tools, and mentioned by almost all participants, prioritize humanization and not replacing the humans. The second question, how do you see the future evolution of palliative care in relation to innovation? Many people mention is a slow process, but with progressive development. Because palliative care doesn't naturally keep up with innovation in other areas, but it will eventually be forced to, however, with a certain delay. Still, likewise, most people mention it's positive and necessary. Some also think in the future it will help with early referral and enhance access to care. Demystification will also happen in the future through education and exchange of experiences, remote care at home, and once again, the participants highlighted that the evolution does not rely only on the technology, but also in people. And I quote, "No digital tool will be able to compensate for the absence of caregivers, treating physicians, ambulances for transport, and hospital beds. I hope that measures can be integrated in care while maintaining the importance of humanization and team presence in care, and difficult to implement due to the importance of humanization of care." Finally, to conclude, I'd like to highlight a few additional reflections shared by professionals that stood out. First, the importance of team training in emotional management was strongly emphasized. There was also a call to debunk myths about artificial intelligence and to approach innovation with clarity and realism. And again, the message to keep it human was clear. I'll quote 2 participants, "Nothing can replace the caregiver-patient relationship, and we must always be vigilant in reconciling the two. The aim of innovation cannot be to compensate the lack of healthcare professionals. Rather, innovation should be used to simplify work, enabling professionals to focus more on presence and care." 2 statements were, innovative tools should allow us to streamline our work so that we can be physically present with patients at appropriate times. Speed and coordination are important in these cases. And finally, a strong appeal for personalized care. In the words of respondents, what's essential in palliative care is contact with the patient and his or her loved ones, and the tailor-made solutions we develop with them to provide personalized care that makes sense. So these voices offer us not only the insight, but a powerful reminder that the responsibility we carry as we pursue innovation in such a sensitive and human-centered field. So we should also have this in consideration. Thank you so much for the attention.